From the coast of Kenya to every corner of the nation, Mombasa cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Power driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation. In every great structure lies a story of strength. A story built on trust, innovation, and resilience. From the coast of Kenya to every corner of the nation, Mombasa Cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Powered by renewable energy, driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation. In every great structure lies a story of strength. A story built on trust, innovation, and resilience. From the coast of Kenya to every corner of the nation, Mombasa Cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Powered by renewable energy, driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation.
Hello everyone, welcome to Let's Voice podcast, whereby we entertain you, inspire you, and motivate you. My name is Presenter Moha. I'll be hosting today's session of Youth Baraza, talking about is health affordable for young people. In addition to, kindly subscribe to our channel. If you have not yet subscribed, I don't know what you're waiting for, so hit the subscribe button. And for our returning viewers, we don't take it for granted, we appreciate. And to our viewers right now, kindly hit the like button on the live in order the YouTube algorithm to push our video to more and new viewers. So if you want to be advertised to our platforms and our pages, kindly reach out the email and the number which is on the screen. And also we are doing a studio booking whereby we do podcasting, media session, all about everything about media. So just hit up the email on the screen and the number. So today I'm blessed to have two awesome guests. So I'll give them privilege to welcome themselves, to tell us what they do, where they're coming from, and what they do in the society. So I'll begin from my right hand side to tell us what's your name, where you come from, and what you do in the society. Welcome.
Thank you for having me in the studio this morning. My name is John Kennedy Micheni. I'm a healthcare provider. Currently, I'm coordinating gender-based violence, adolescent and young people, and mental health-related issues in Likon Sub-County and the county government of Mombasa. Thank you.
Okay, welcome. So to my left side, tell us what's your name, where you come from, and what do you do in the society, or what keeps you running every day.
Thank you so much. My good names are Madam Sylvia Awino Chola, and I'm a happy health consultant, very proud in helping people realize their purpose in life and also supporting them with the natural support. And my offices are opposite Posta, no Maneno, just on your way to a mosque. There is a building called Calcare. That is where my offices are, and at second floor. Yes.
So when you begin from you, so when you say health is affordability, what do you mean affordable to young people? Because today our topic is health affordable to young people. So what does it affordable mean to young people? In just phrase the meaning.
Affordability to young people, according to me, affordability is something that anybody, they can access. Anybody, wherever they are able to access the facilities. They're able to access health programs. They're able to access advisors from help people who are ready to support them. So affordability in simple term is where a young person from rural areas, they are able to access. But in reality, that is not the case. You find that in rural areas, young people are struggling to access the health support, especially when you look at the distances. They have to walk long distances to access the facilities, and also the lack of education, right education. They lack that because most of them, they do not have smartphones, so they lack timely information. And also the service providers, they are few. Qualified service providers are very few, and you find that our young people are really lacking behind when it comes to information. They get delayed information. So to me, that is not affordable health services to our young people.
Okay, thank you. So to Mr., what does affordability means to you, to young people?
As my colleague has rightly stated, you find that when it comes to affordability means that the services that are being provided, health services that are being provided, young people can actually walk into any facility and they get these services without any restrictions, without any, at a affordable fee, in a way that actually these services, when they walk to that facility, they get the services at that particular, they find that the services are readily available, and the providers also are there, the drugs are there, if the investigations are there. In other ones, everything actually it's at their disposal. So you find in that way, and also bearing in mind also the cost, that whatever the kind of services that are being given, that young people also can afford. to get them.
Okay, so to you, Mr. Kennedy, from your experience, what are the biggest challenges have you seen in the healthcare center in Kenya?
Okay, you find that we have several challenges in healthcare provision, especially in Kenya. One of the key barrier or challenges that you find that is inadequate budgeting when it comes to healthcare provision. You find that like now, as per the Abuja Declaration, healthcare provision in every country should be around 15%. But now we find that, especially here in Kenya, that wherever we have this budget, that the provision of this budget actually falls short of what is expected, below the 15%. So you find that one of the key challenges is finances, financing the healthcare sector. And the other challenge, you find that, yes, there is a great shortage of healthcare providers, from the doctors, nurses, the clinic officers, nutritionists, the lab people, they call themselves lab scientists. You find that actually there is a great shortage. If you compare the people who are in health sector, the professionals that we have around, and the population, you find that actually there is a challenge, because you find that the population is going up, but the number of people that are being employed actually remains constant. So that's a challenge. You find that, yes, one doctor is treating so many people and is not around, always available. So you find these are some of the challenges that we are finding in health sector. The other challenge is the infrastructure. You find that in most facilities, we don't have structures that can support the services that are being provided. You find that in several health facilities, the experts that we have are sharing the same room, and the number is quite big. So you find that in some instances, and especially the government side, you find that they have now to come up with the modality of accommodating this population. Or in other ones, you find that people, because of the queue now that you find in those facilities, now opt to go to the private sector. So infrastructure is a challenge. And then the other challenge that we are finding in health sector is that there is no good political will. And especially now when you come down to some of the counties, you find that the politicians that we have are not willing to support the health sector. And then there is that aspect of also corruption and mismanagement of public funds. Hence now getting us in the situation whereby you find that now there are challenges. There are challenges. Actually, we cannot provide these services adequately to our people.
So do you think the health facilities, because you can see some parts of Kenya whereby there's always a queue when looking for medicine. Many people suffer, maybe say a mother who she's pregnant, expecting a child, maybe there's no lack of facilities, good facilities. Can it be also biggest challenges in part of Kenya?
Yes, we find that in some of our facilities in this country, I've stated that actually there is shortage of staffs. Then the other thing, as you've asked about the ANC or expectant mothers, they go to these facilities and then they lack the right people to attend to them. And then at the same time, you find in some of these facilities, there are no medications. All you find that when now the investigations, maybe a doctor may see the client and request for some investigations. But now you find that the setup cannot actually provide the same service. Now these people are to be sent to another facility or to another place so that they can do the investigations, then bring the investigation to the doctor. So there is a challenge. There is a challenge.
Okay, thank you. So to you, Sylvian, what do you think is the biggest challenge, to your opinion? What are the biggest challenge to the health side?
The biggest challenge to health side is overcrowding. To most of our public hospitals, when you go there, you'll find the crowd is huge, and service providers are busy, and you find that somehow, because of the bigger crowd, they develop attitude towards our people, and in that case, you find that most people they go there for services, but again they come out without getting the help they expected.
Yeah.
And the other thing is the other problem is about also the costs. You find that we have SHA, which is supposed to cover the medical, but you find that it's not covering most of the cases that people go there to be attended to. You find that people go there, but again they have to spend their own money, which is again a problem. It is a challenge to the people of Kenya. And also you find that there are certain areas the SHA is not covering, or the health services are not covering. You find that there is a gap in nutrition advices, that these people are not getting the correct or timely advice on what to eat right and when to eat it. So we find that it is a challenge that our people need to be enlightened on.
So to you, Sylvian, with the report of underfunding or the shortage of equipment in our facilities, has this affected to people or rural or urban areas? Because there are some facilities whereby you can get few equipments whereby, and someone is in a critical condition. So due to that, there's lack of experience to the people who can work on the equipment.
Yeah, true. That is another challenge, a bigger one, an elephant in the room. Lack of equipment, especially when it comes to, let's say, the case of cancer. Many people are not getting timely attention because the equipments are few. They have to be given a longer date so that they can come for the medication. And you know, the disease cannot wait for that date to come. You find that most people are dying, and yet the day has not come yet to go to see the doctors. And also the shortages of service provider is also a challenge. You find that some facilities have the equipment, but again the qualified people to do that are not there. So you find that again, that is also a bigger challenge to our people. And also these lifestyle diseases are like cancer, diabetes, pressure, arthritis. These are diseases that can be controlled, but because our people do not have information, they end up suffering these diseases because they were not taught earlier so that they can prevent them. So my take on this as Nourish with Sylvia, we teach people, we educate people on how they can take care of their health before it comes to a serious case like cancer, diabetes, pressure, and all that. We teach you on how you can prevent. Yeah.
Okay, thank you. So to Mr. Kennedy, what does NGO mean for the person who is watching you, and what does NGO do in the community health? So there's someone who is watching does not know anything about NGO. So kindly can you explain to him what NGO does in the community health?
Okay, NGO means a non-governmental organization. And you find that actually this non-governmental organization, maybe if I can give an example of a few, like Kenya Red Cross, like AMREF, like MSF, and also we have LVCT. You find that they partner with the government or the county government so that they can enhance provision of services to the community. You find that they have several programs that they support, like HIV testing, treatment, and also diagnosing. And also you find like other NGOs, they do support gender-based violence, others support adolescent and young people programs, and also mental health. So they've come to partner with the government to ensure actually that the services, some of these services are getting down to the common mwananchi. And we find that, like here, if I can give a good example, here in Coast, and especially in Mombasa County, we have several NGOs that actually are partnering with the county government of Mombasa, and they are doing an excellent job. So they are really assisting, where they partner together with the county government and ensure that people are getting relevant services, and especially they hard to reach. There are areas that actually are hard to reach, like areas like, if I give an example here in Mombasa, like Mwakirunge, Maungunja, those places, or in slum areas, you find that they have programs in those slum areas, and actually our people are reached and they are given the health services.
So, to my question about the NGOs, do you think mostly NGOs are professional people, and which are they are specific whereby they can help us to treat about the challenges which are in the health sector?
Okay, you find that most of the NGOs have experts and technical people who assist them in running their programs. And you find that now they come on board so that you can partner with the government who have the expertise, so that now they work together. Yes, there is that possibility that you find that even in some of the NGOs actually are supporting the counties by even employing professionals. They cater for the salaries of these experts in the field, and the NGOs actually, pay for the salaries. So you find that actually they integral in terms of supporting the government to give provision to wananchi.
Okay, thank you. So, to you, Sylvian, what are the hidden reasons whereby youth avoid clinics, or youth they don't like to go to hospital? Maybe they say, when I become worse or something it's high, then I go to the clinic. So, what do you think are the hidden reason and are the main causes?
Thank you so much for that question. It's a very wonderful one. And my take on this is that most youths, they experience stigma, society stigma, and also lack of information. When you don't have information, you will fear. They live in fear. They feel like, when I go to the hospital, or when I go for medication, how will people carry me? How will people take me? There is that fear. They have that fear that they need to be told about. And the other thing is also privacy matters. You find that some people, somehow they know they are not good at keeping secrets. So I will come to your facility. Recently, I had an incident whereby a friend of mine came to me, and she was telling me she was abused by her husband, and the husband was an addict, and she feels like maybe the husband is infected. So she went to the hospital to get the PEP, whereby she can prevent herself before she has the intercourse with the husband. But now the question she was being asked, she even left the place without being attended to. So you find that this person, if she was well catered for, well advised on how she can carry herself, maybe she would have had faith in the service providers. So it is a big challenge when it comes to privacy matters, that we need to take care of our people of Kenya.
So you see about the hiding infection or diseases. People like hiding small infections. Say like if someone has a flu, maybe he or she can hide it. So what's your take on that also?
Hiding flu can result into a bigger thing. I would advise people, especially youths, don't hide. If you feel anything in your body, just rush, go and get checked, because that small thing can result into a bigger thing. Don't hide at all. If you feel like you're not trusting yourself, you are not trusting anybody around you, just go to a friend or maybe a colleague, or you can even go to your social medias. Nowadays they are readily information. You can just Google, you can just you can use your social media well, and you will learn all this from there. So don't hide, just do something for yourself.
So thank you. So to you, Kennedy, is there any support whereby the government has helped the healthcare in Likon? Because you said you are sub-county of Likon. So is there any support whereby you can see by visual a lot of people are helped to avoid the challenges which are now in the societies?
Okay, that's a very good question. And you find that in Ikon sub-county, yes, we have the structure of the healthcare provision under the Ministry of Health, Mombasa County. We have the medical officer who is in charge of the sub-county. And under the medical officer, we have several program officers coordinating their respective programs. And now also we have the health facilities under the government, which are giving the health services to the community. In this structure, you find that also there is a community based structure whereby we have community health volunteers, or the ones who are commonly referred to as CHPs, at the community level. And each CHP has a household of like 100 houses. She's taking care of those people who are in those houses. And we find that we've been equipped and trained on how to assess for illnesses, danger signs in pregnancy. They have been given even equipment like a BP machine so that they can monitor a client at their households, at household level. And actually, if they find anything alarming, they do refer. They do link these clients to healthcare centers or dispensaries that we have around. And we find that actually, together with other ministries, like the Ministry of Environment and other government institutions, we ensure that health is given the priority in Likon sub-county, and not only in Likon sub-county, but in entire of Mombasa County, to ensure that our people are in good shape. Because if actually they have issues to do with the diseases, then even the productivity part of it, you find that actually the productivity goes down. So that's something that we are taking care of. And wherever there are even outbreaks, there are disease surveillance officers that we have at the ministry, so they can pick anything that we can think about when it comes to health. So the government is well in standby or well equipped in terms of is doing surveillance for these diseases, and that's why you can see everything is under control. Thank you.
So you're saying whereby the government is supposed to support the people of Likoni, whereby yet you can see people like women who are laying on floors with their children, maybe the lack of medicine or equipment, whereby, let's say, in various hospitals, whereby people can say the government is supporting, yet we are not seeing the support. A lot of women are crying on the doors, whereby they're saying they lack medicine, equipment. So what's your take on that?
Okay, my take is that we as the government, we are doing to our level best, and you find that each and every facility, like now as we speak, we have SHA that is supporting our facilities, and we are encouraging the population, especially in Mombasa County, to ensure that they are registered in SHA, so that when they go to the health facilities, they are given these services. And when maybe there are challenges, there is a channel that is there to channel their concerns, so that to ensure actually the health provision is for everyone. So, and one thing that we should know is that Mombasa County actually is one of the top counties in Kenya who have really enrolled well into SHA. So I would encourage people out there, including young people who are not enrolled in SHA, to do the same, so that now we avoid some of these challenges that we are facing currently.
Okay, so thank you. So my director is telling me we go for a break. So we are taking a short break, whereby this video is proudly sponsored by Mombasa Cement. So kindly watch the video and support Mombasa Cement.
In every great structure lies a story of strength. A story built on trust, innovation, and resilience. From the coast of Kenya to every corner of the nation, Mombasa Cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Powered by renewable energy, driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation. In every great structure lies a story of strength. A story built on trust, innovation, and resilience. From the coast of Kenya to every corner of the nation, Mombasa Cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Powered by renewable energy, driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation. In every great structure lies a story of strength. A story built on trust, innovation, and resilience. From the coast of Kenya to every corner of the nation, Mombasa Cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Powered by renewable energy, driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation. In every great structure lies a story of strength. A story built on trust, innovation, and resilience. From the coast of Kenya to every corner of the nation, Mombasa Cement stands as the backbone of progress. With world-class technology, sustainable energy solutions, and unwavering commitment to quality, we build more than walls. We build possibilities. Powered by renewable energy, driven by excellence, trusted by millions. Mombasa Cement, strength that builds the nation. In every great structure lies a story of strength.
So to Mr. Kennedy, so as we were talking on conversation, we heard about saying about SHA. So can you tell us how is mandatory for SHA registration? And there's a person who is watching you there. Tell us what is SHA and what does SHA help and how can one register the SHA?
SHA is a social health authority. It's more or less like an insurance whereby one register and they pay a certain fee. And after you have subscribed and paid this fee, you find that wherever you go to health facilities, government facilities, you find that this insurance caters for the expenses that we incur while you are in a health facility. Be it the investigations that will be done, or maybe someone has been admitted. So SHA will take care of a certain percentage of the amount that is required for you to pay while you are at that facility or when you are discharged to go home. And we find that also SHA can also be used as an outpatient insurance, whereby they cater also for those who go for outpatient services. So I would encourage people to register so that they can get these services when they go to health centers or dispensaries. And you find that actually compared to other insurances that we have around, you find that SHA actually, it's it's reliable. Then the next thing you find that actually it's the cost, it's lower compared to other insurances. So I would advocate for SHA.
So thank you. So to you, Sylvian, while you are talking, you mentioned about something about nutrition. So how does nutrition affect the rising cost? Now there's a rise of cost of living, basic standard of everyone. So how does it affect to poor nutrition to the people or young people?
Thank you so much. Nutrition, it's good eating habit. What you take in will give you, it will give you two things. Some will give you toxins and some will give you nutrients. So when it comes to nutrition, you have to eat vegetables. You have to maximize on fruits. Yeah. But you find that some families are not able to access good fruits. Yeah. And also, nowadays, some families can access these good vegetables, and so you find that at long last, these will come back to us. That are supposed to support our cells, so that we are protected against the lifestyle diseases. So this is a big challenge. Even maize nowadays. I remember when we were growing up, we could wait maize for like 6 months for us to eat maize.
Yeah, that's true.
But nowadays maize is everywhere. Mahindi choma iko kila mahali. Utatembea utapata mahindi choma. You ask yourself, hizi mahindi zinatoka wapi?
True.
Yeah? Zinatoka wapi? But because siku hizi agriculture imekuwa advanced, hauhitaji kungoja sana. Agriculture has been advanced. Genetically modified foods. We are taking in genetically modified foods. Na hizo ndo zinatuletea magonjwa mengi sana.
And to cut you short, do you think those genetic add any nutrients into our bodies?
Most of them not. Because zimewekewa machemicals ndo zikue. So you find that tunazikula ndio, lakini hazitupatii madini tunayohitaji katika miili zetu. Na ndio maana utapata watu wengi wako na pressure, wako na diabetes, watu wako na makansa kutokana na hizi chakula tunazokula. Yes.
So thank you. So to you, Mr. Kennedy. So now mental health it's very expensive. So how can the government make it easy accessible to everyone? Because now a lot of people, they are saying the health services are high, and people are complaining because now there's a rise of cost of everything. So how can the government make it accessible to all people, and all people get good treatment?
Okay, it's true that mental health issues are on the rise. And even before you go for what we can do for the ones who are sick, it is good that we take care of ourselves by doing something that we call self-care. Issues are there, stress is there, there are challenges in life. But before now we get to the moment now we see that someone has a mental health issue, it is good that we know how to take care of ourselves. When you have something that is stressing you, it's good that you talk it out. It's good that you go for counseling. You can also go visit a psychologist that are really available in our facilities, so that in that way we avoid that moment where now one will come to the facility with a mental health condition. So in that way, I want to believe if we put the mitigation factors that can actually prevent people from becoming, being mentally sick. And these are some of the issues that we are doing in the community together with the partners that we have, the ones who are supporting mental health department, to ensure that people remain in a good mental health state and they can make good decisions. Then you find that also for the ones who maybe might be having challenges in mental health, as Mombasa County, we've really done our level best to ensure that we are doing something that is called decentralization of mental health services. Initially, we had Portree's mental health unit providing mental health services alone in Mombasa County. But now, as we speak, we've decentralized these services even to other sub-counties. You come to a place like Likoni, you find that we have mental health experts in Shikadabu Health Center. So one doesn't need to go all the way to Portrees to access these services. And at the same time, you find that the government has really invested in ensuring that health care providers have been trained on how to handle mental health cases when they go to the respective facilities. So you find that in each and every facility, we've started by training these people to identify, because mental health issue, actually, it's something that is you cannot easily pick. But with proper screening at the facility level, you can hear someone who is having some mental health aspect or stress or depression. And from there, this person actually can be treated at that particular point. It's only for the complicated cases or cases that are quite that require actually admission, that the high time now we can refer these kind of cases to facilities like Portrees. But you find that really the government has really invested in mental health, and I want to believe that each and every person, wherever they are, they can be reached by information. Because if we empower community, you find that most of the people actually who are undergoing mental health issues, probably they lack empowerment. Because we find that like young people, they engage themselves in drug and substance abuse. But how I wish they had this information prior, so that now they know the kind of issues that they might be getting into and avoid these kind of issues.
As you're saying, whereby the health awareness or mental awareness is the government can make it accessible to everyone. So, to my question to ask you, there are people who are laying on cause general, who they lack funds, they lack a lot of things. So they depend on sponsorship or people who have good heart to pay for them. But you are saying whereby the government can support to make accessible to everyone. What does that mean to you?
Okay, we go back now to the SHA issue, whereby now, if actually everyone is enrolled in SHA, you find that the SHA will take care of the bills in respective facilities. And for the ones maybe you are not in a position, I don't want to go into politics. You find that, okay, I understand the governor actually and taken responsibility of paying for intelligence. That's people maybe like the elderly ones, the ones who actually are from very poor background and they cannot afford this. So you find that, okay, there are some efforts which are being done. But now you find that, okay, not everyone actually can afford even that SHA itself. But for the ones who can afford, let them contribute to this fund so that actually they can get a treatment or services. For the ones who have challenges, actually even the community itself, I call upon the community so that, and the organization of like-minded, and see how best we can assist these people to get to be enrolled in SHA so that he can get the same services we are talking about.
Oh, thank you. So to you, Sylvian, what role does peer support help the community to align with the health affordability to the young people? What the peer support, what does it help?
Okay. So peer support is helping young people, is helping to education, and also creating awareness, and giving them directions. Especially when I talk on my side on Nourish with Sylvia, what we do, we educate young people on how to take care of themselves. Especially young people are the ones who are really suffering all these when it comes to gender-based violence. I mean, yeah, many young people are suffering such cases. You find that they are raped, and you find that most of them are not getting enough food in their homes. They are not able to access the hospital facilities, and we help them because they lack education, they lack somebody to lead them. So we are there to help them, to direct them, and to show them what to do in their daily life.
So do you think the peer support helps in the bridging of young affordable people in the health side?
Yes, it is helping by showing them the direction. And once this young person has known what to do, of course, most of them hide. They don't want to go to the facilities because they lack knowledge. Nobody has told them that when you go to the hospital, when you find a person who can advise you, you are able to, you will get help. So most of them hide. Most young people find that a young girl has given birth and she's hiding at their home. So they don't want to come out so that they can get help so that they cannot repeat the mistake.
That's true,
yeah.
because a lot of Gen Zs, they don't like to be told. They like to straightforward.
Yeah.
When you tell them something, you go straightforward.
So they like to be told straightforward. Yeah, they need that straight information. They don't want this hidden information. So you find that most of them are hiding, and when you come out and talk to them, they come out. They come out and they get help. So peer groups are really helping on that.
Can you give us examples of peer groups which you know, which have brought some impact to the society? If you know, if you have heard of them.
Yeah, we have young mothers. I know my good friend here. He's also in that group. It is really doing a good job, especially where I come from in Changamwe. It has really, I know of girls who have benefited from that. Yeah.
Okay, so to Mr. Kennedy, how can youth lead to solution by advocacy for the health and awareness? You know, there's a youth whereby he's sitting down, but he has some issues about health, but he cannot advocate for the health. So how can youth help about that?
Youth have a lot of energy, and they have they like even learning new things. And you find that actually when it comes to youth issues, there's a slogan that actually they have. They say there is nothing for us without us. So if we can give these young people an opportunity to air their issues, and at the same time give them an opportunity to come up with the solutions for the same problems, they are very innovative. You find that young people can come up with the ways of tackling issues. At the same time, young people can be empowered so that they can get to the space of advocacy, whereby they can advocate for their rights, whereby they can push for things to happen, whereby they can even have representative at the leadership level, even at the county level, at the county assembly, even at the national level, whereby we have our parliament. and also at Senate level, and at any other platform whereby they can air their issues, and they actually, because they are they articulate to their issues, and you find that they have a lot of energy, and they can push for things where is a need. And you find that, like now, if I can refer to an issue that we had last, whereby an organization actually end to a youth-led organization, government of Mombasa, and actually air their issues, whereby they needed these youth-friendly services at their. Actually, the county assembly came down to facilities to access the situation, and actually, I want to believe now this year, because that assessment was done, the county government of Mombasa will have a provision, a budget for youth-friendly services or youth-friendly centers in our respective facilities, so that these young people can also come for these services at a place that is conducive for them. And when these young people come together and find their peers in these spaces, they just feel good, and also they will have that opportunity, or they will encourage others to come for the services. So young people, yes, they can drive this agenda, and you find that actually, as my colleague Sylvia said, that you find that young people, when it comes to seeking health services, they have a unique way of doing it. So, but if they can find their colleagues, their peers in those spaces, you find that when it comes to referral, linkage, and also health provision, then that will be appropriate, because now they will have a place whereby they can go and get these services that we are talking about.
So to you, Kennedy, given that there's 67% of people who are unemployed youth, so how does it affect people financial stability towards the head of affordability? Because people are lack of employment and they cannot sustain themselves towards the payment of the bills or everything.
Okay, that is true. You find that majority of the young people, despite having gone to school and pursuing various courses, they are out there without employment. And you find that in that way now, that is causing a lot of stress. It's causing a lot of family burden, and also because now the parents have really invested in this person. Then at the end of the day, he's just there in the house doing nothing, so it becomes a burden. And also you find that due to this, the mental health issues, actually, because the youth are struggling out there, they tend even to get into drug and substance abuse, thinking that now this is a way out, but now they find themselves in a very difficult situation. So for the young people, we would encourage them, yes, as much as there is no employment. We know that SHA is not for the employed people, but they can register and then pay ile inaitwa mdogo mdogo. They can contribute to that insurance, but they can pay in in bits. It's not a must that you pay at once. So I want to believe that actually, if they can enroll in this SHA, then they will be in a better position, whereby in case of any issue, they go to the facility, they won't be restricted to get the services. They find that actually the services are readily available, and they can be helped.
So thank you. So to Sylvian, my last question to Sylvian, what are the prime barriers to sexual and reproductive health for young youth or for young people? What are the barriers?
Okay, health barriers
Yeah.
to young people. Health barriers to young people. This means, why are young people suffering, and why are they suffering? First of all, like I said, stigma. most of them, once they know they have been they have found themselves in a situation, they don't want to come out. They don't want to accept. Or maybe they accept, but they don't, the rest, they stigma, they point fingers at them. What happened? So young people have ego. They don't want to find themselves in a problem or in a situation. So they will living in a denial. So that is one of the barrier. Number two, somebody who can listen to them. Not everyone is willing to listen to them. Young people are outspoken, but who is willing to listen to them? And that is why we have peer groups to do that. So if a young person, you're out there and you know you are in a situation, just find suitable peer groups whereby you can not die alone, or you should not, because a lot of killing themselves just because they don't see way out. But I would advise young people, kindly find someone whom you can talk to. Find someone whom you can talk to. Go to somebody elder than you. Somebody who is older than you will direct you. Don't listen to your friends. Most of them do not have right directions. So they are going to mislead you into doing things that are not good for your health. And also, I would also urge to young people, if you know of somebody who has issues, don't leak their information out. Because once this person has known, their information is leaked. Like nowadays, we have social media. Maybe, young people are so, they are so adventurous. They are so lively. When they are doing things, especially when you are with your partner, you want to take photos, you want to take videos while you are enjoying. So these things will be used against you when you are no longer in a relationship. So when you are doing these things, remember there is tomorrow. Don't just do for the sake of doing. Enjoy, yes, but don't use cameras, because somehow some people have mental issues. When you leave your partner, they will develop mental issues and they will not want to go down alone. They'll want to go down with somebody. So they will end up using your photos, videos on social medias. You find your photos, your videos are leaked. And once they are leaked, you will be disturbed. And that's why you find most young people ending their lives just like that. So I would advise you, be responsible, take care of yourselves, and the world will take care of you.
So as we're winding up, I have two funny questions for each of you. So to you, Sylvian, why do people fear bills more than actual illness sometimes? Why do people fear hospital bills more than actual illness? People fear bill than illness. Why?
Okay. Why people fear bills, hospital bills, than illness itself?
Yeah.
Somebody will say, let me just, wacha tu nikae kwa nyumba, nitapona. They don't want to face the hospital because they are high bills.
Yeah, true.
Yeah. Like we said, there is scarcity of jobs. Most young people are not employed. They don't have money. And I like it when you said parents have used, I think it was my colleague there who said parents have already taken you to schools. They have paid, most of them, in most cases, they sell their properties to take you to school. But when you come out here, there are no jobs. You become again a burden to your parents. So you find that when you become sick, you don't want to come because you feel like you will be draining your parents. So you just keep quiet to yourself. So I wish SHA was not like an insurance. My colleague said you can subscribe and pay. I wish it was not like that, whereby any common mwananchi anaweza tu walk in a hospital and they get they get assisted without any payment. That will be very good for our young people, and those who are also elderly, they could also benefit from that.
Okay, thank you.
Yeah.
So to you, Mr. Kennedy, is it true that for many youth, rest and water is it the first and last treatment? Because when people is kuna kama sickness, he just takes water and then rest. Say, when I wake up, I'll be fine.
Yeah, I think that's the remedy that not only even young people,
Or even
but
even elders, when you tell your parents, I have a headache, she'll tell you, drink water, then go and sleep. When you wake up, you'll be fine.
yes, water is life. So to some extent, you find that yes, when you take water, it will assist you because of rehydration. And also rest is good when you have illness. So when someone is sick, we normally even advise some. That's why you are given a day off so that you can go and have a rest.
And rest.
And also we encourage people to take a lot of water, because when you take water, what happens with that water is that even the toxins in your body, and also bearing in mind also the drugs that we give, these are chemicals. So when you take water, there is that kind of, they flush the toxins in your body. So to some extent, I can say yes, there is some advantages, but it's not always that when you take water and have a rest, then you get healed. If you have an issue, it's always good that you go for checkup. One other thing, you find that before people come to the health facility, I don't know if it's an African way or Kenyan way, you find that they've taken some kind of medicine before coming to the hospital. Okay, as my colleague has said, yes, there is that, the think of the bills
Me,
at the hospital level.
I can add there about that, because there's a parent whereby the kid is sick on, maybe he has a headache
Or fever.
fever. He'll give him a she Panadol. Then they say why the fever is coming higher than it was usual. So she's taking her to the hospital. No, so in start she has already given her a pill which the doctor has not prescribed to be taken.
So you find that in most cases, actually, they come to the facility while they've already given some drugs,
Yeah.
which is okay. It's first aid. Let me call it so. First aid at the, at home or at that particular moment. But you find that also majority take unnecessary drugs. But what they need to realize is that actually it is always good to see a doctor. There is a common saying in Kiswahili that how do you put it? Okay. Kujenga ukuta ama ni kuzuia nini? There is a saying in Kiswahili. Kuziba ufa ni bora kuliko kujenga ukuta. I want to believe that's how they in their own understanding do things. But it's always good that actually whenever you see someone is not okay, it is good that you take that person for checkup to avoid a situation whereby someone comes to the facility while even complications have already set in. And now it becomes very difficult to revive this person or rather reverse the situation. So my advice is that whenever you have an issue relating to health, it is always good to see an expert so that you can be helped.
So as we finish, to you, Kennedy, as you're watching the camera, give us word of parting of short, and a person who is watching you, can you give her or him advice as we're winding up?
To the young people out there, I would advise you that actually if you have an issue, that you seek for medical help in advance. When you have challenges in life, challenges are there, and no one can say that actually is okay. There is a saying that we normally say that it's okay not to be okay. So if you have a challenge, kindly make a point of looking for someone to assist you and ensure that in your cycle you have a support system, people that you can rely on when you have an issue. Thank you.
And where can people get you? Your platforms?
Okay. You can get me in my office is situated at Murima Hospital. You can come in for help or any kind of consultation for free, because I'm there to serve young people and I'm willing actually to assist you in any way. If maybe you cannot come over, I can also give out my number. My number is 0721 63 7742. You can reach me using that number. You can call at any time. My number is like a police station. You can call me at any time. And then you can also use that number to get me in WhatsApp and also in other platform. But I would encourage you that you can also text. You can call at any time. Thank you.
Okay, so thank you. So to you, Sylvian, at first, so can you tell us, as you can see, there are some products there. Can you tell us the products, then give us word of parting of short, and then give us advice, the people who are watching you, and also finish with your platform whereby people can get you, they can reach to you, and whereby they can support you.
Thank you so much for the opportunity. As you can see, I have products here. I am in wellness industry, and like my colleague said, don't wait. When you feel like you are sick, kindly run for your life. But I am here to tell you that the diseases can be prevented. They can be prevented. Why? Because if you have nutrients in your body, then you won't be attacked with any diseases. Unaambiwa kwamba askari wa mwili wako, the cells are cells ndo maaskari wa mwili wako. So kama wale maaskari wako empowered, then wewe hautakuwa mgonjwa. So for instance, mgonjwa wa HIV anatumia ARVs ndo wale maaskari wake wakuwa empowered. So what I want to remind you is ARVs are just like supplements. Why? Because they give you nutrients. So what are supplements? Supplements are extracted nutrients from organic foods. For example, chakula tunayokula ziko na nutrients. Lakini nowadays, we are not getting 100% from what we eat. We are not. Actually, not even 50%. So each and every person, you need supplement to supplement your body. You need supplements for your energy. You need supplements for your muscles. You need supplements for your entire body. For example, nowadays, as we are speaking about young people are struggling to having children. Why? Because their bodies are full of toxins. So you need to flush out all the toxins that are accumulated in your body systems. You find men are struggling, even women are struggling from the other hand. So once you have supplements that can support your body, can support your hormones, you will end up having children, becoming a happy parent. And even those with pressure, you find that your bodies are also full of toxins. The blood system is clogged. The blood is not flowing. So for you, you will use, over-the-counter medicines, like my colleague said, utanunua madawa utumie usikie vizuri. Ununue madawa usikie vizuri. Lakini are you treating? With the supplements, they come to treat the root cause. Sababu ambayo imesababisha wewe kukuwa na clogged vessels ama clogged tubes. So the supplement will come and unblock the tubes, unblock the veins, and the blood will continue flowing smoothly. For example, here we have what we call liver care. Liver care is a product for detoxing. You know, our liver does a lot of work. Hiyo ndio inasaga chakula, hiyo ndio ina transport chakula from nutrients from your to the entire body, na zile toxins zinatoka nje. So liver ni kama kichungi, kinachunga chakula mzuri inabaki kwa mwili na zile mbaya zinatoka. So kama nyumbani unaosha kichungi yako inang'ara, what about your liver? What are you doing to support your liver? So we need liver care to care for your liver so that your liver can continue doing the best it can do. And also we have muscle and bone care. Muscle and bone care, these are very good products for your muscles. Everybody needs muscle bone care because kama hauna muscle, you cannot move your body. Wengi wamekuwa attacked na arthritis, stroke, sciatica, mguu na kuuma kuanzia kwa kidole hadi huku. Wengi wako na issue na mgongo, mabega, their backbones. You need muscle and bone care to go and correct the mistakes in your body. Okay? And also we have supplements for the beauty. Ladies who want to look extra. Even men nowadays, they want to look extra. So we have products for you. It's just as a supplement. Hauhitaji mafuta kupaka mwili. Hauhitaji smearing oils. You need something to go and correct. Unapata mtu anatokwa na mapimples. Unapata mtu skin yake iko rough. Atanunua cosmetics products, atakuja apply. But this person will not fully healed. Those things are inside. So they need to be corrected from inside because everything starts from inside. So if you can correct from inside, then you will not have a problem with the outsides. So I have a lot of products which can deal with your particular problems. Kama uko na pressure, uko na arthritis, uko na ulcers, unatafuta mtoto, uko na a lot of issues. You can reach me out on my number. My number is 07 000 55969. My number is a +254 7 000 55969. I'm also on TikTok, Nourish with Sylvia, NOURISH with Sylvia, WITHSILVIA. Nourish with Sylvia, ama forever young. If you want to live forever young, then just go and subscribe on my TikTok channel and let's journey together.
So thank you for coming. It was a pleasure to have you, both of you. It was a nice session. So to our viewers, kindly watch the video, subscribe the video, share it to more people. And also, if you want to be advertised to our platforms, you can reach us to the email and the number which is on the screen. Also, we are doing studio hiring, whereby we hire for podcasting sessions or all media setups. So if you need to do so, kindly reach out the number on the screen or text on the email. I've been your host, Presenter Muha. Till we meet next time. Have a nice time.
A story built on trust, innovation, and resilience.